Ministry of Health of Ukraine. Krok 2. Medicine. Year 2019, number 122. A 39-year-old man suffers from chronic adrenal insufficiency and receives replacement glucocorticoid therapy, hydrocortisone 15 mg per day. He is to undergo elective surgery for calculous cholecystitis. What medication adjustment should be made on the day of the surgery to prevent the development of acute adrenal insufficiency? A. Increase the dosage by 2 to 3 times. B. Prescribe a large volume intravenous fluid infusion. C. Add a mineralocorticoid. D. Add an antibiotic. E. Cancel the drug for the day of the surgery. Using a steroid is a safe and effective means to reduce postoperative pain and edema. However, steroids delay healing, inhibit collagen synthesis, and increase the risk of postoperative infection. The enzymes cyclooxygenase-1, COX-1, and cyclooxygenase-2, COX-2, catalyze the conversion of arachidonic acid to prostaglandin, PG-H2, the precursor of PGS, and thromboxane. Steroids inhibit their synthesis, consequently reducing postoperative edema. The answer is A. Increase the dosage by 2 to 3 times.